Birthing and newborns. This video will introduce you to the infant's transition from the womb to the world, from labor and delivery to newborns, to transitioning to parenthood. This is an amazing time in every parent's life. The more knowledgeable you are, and the more confident you will be, and therefore truly enjoy this precious time together as a family. The average pregnancy lasts 280 days, or 40 weeks. About 85% of women deliver within 7 days of their due date. Pregnancy is considered full term if the baby is delivered between 38 and 42 weeks. Deliveries before 37 weeks are considered preterm. Deliveries after 42 weeks are considered postterm. How does a woman know that labor is about to begin? Lightening. Lightening is the gradual process of the uterus sinking downward and the fetus descending head first. The baby moves down toward the pelvic area, therefore lightening the breathing and making more room for the organs. It's going to make the woman feel more comfortable. Engagement. Engagement is when the largest part of the fetal head has passed through the mother's pelvic rim and into the pelvis. The baby is getting into position and getting close to the mother's cervix. Lightening and engagement are two signs of delivery. There are other more obvious signs of labor, which include the mucus plug. The mucus plug is excreted and has a bloody show. This means the mother will notice some bloody spots. The mother's water may also break. The water is the amniotic fluid that protects the fetus. This is starting to leak, or it could have been ruptured. The most common sign is a contraction. Contractions are the movements of the muscles in the wall of the uterus that push the fetus through the birth canal. It will start like a period cramp and then become more intense, regular, and closer together. Okay, now that you are in labor, you must realize that there are 3 stages of labor. There's the first stage, second stage, and third stage. The first stage of labor begins with contractions and ends when the cervix is dilated and effaced. Fully dilated means that the cervix has reached 10 centimeters. Fully effaced means the cervix has thinned out until it is paper thin. This is the longest stage of labor. It can last from 1 to 20 hours. The first stage of labor can also be broken down into 3 substages: latent, active, and transitional. Latent phase means that contractions are mild to moderate, irregular, and not very painful. This is usually when the cervix dilates to about a 3. During the active phase, the mother will dilate up to about 7 centimeters, and the contractions will be moderate to strong. Finally, the transition stage, which only lasts about 20 to 40 minutes, or when the contractions are regular and very strong. The pain can be severe. Full dilation, which means 10 centimeters, is completed during this stage. The first pregnancy is usually the longest, so the next delivery should be shorter than the first. Now that you've reached 10 centimeters, we enter the second stage. This is actually when the baby is delivered. This can last several minutes to 2 hours. During this time, the mom needs to bear down and push. The mom will feel an urge to push. You want to be in a position that will allow you to push more effectively. With every push, the fetal head will become more visible. Soon, the birth of the baby will happen. After the head crowns, the head, then the face, and chin appear. During this time, the doctor will stop the mom from pushing and remove fluid from the baby's mouth and nose. If there is fetal distress, which means the fetus is not getting oxygen or is experiencing some other complications, or even if the mother is exhausted and having difficult time pushing, forceps or vacuum devices may be used to shorten the delivery. After the delivery of the head, there is a rotation, and the shoulders will pass through the birth canal, and then the rest of the newborn appears. At this point, The umbilical cord is clamped and cut. Your baby has finally arrived, and usually now the newborn is then given to the mother. The third stage, or the last stage of labor, is the expulsion of the placenta. Mothers do not even notice that this is happening most of the time. This is when the placenta is expelled. There will be contractions happening during the first 5 minutes after birth to help this along. Don't worry, these are very mild contractions. When the baby is born, it does not come out like a dream baby, but nor do you care at this time. However, the baby will be covered with a white, cheesy substance called vernix. The baby may or may not even have hair. If the baby does have hair, it might fall out or change colors as he or she gets older. The face may be asymmetrical in form due to the trip through the birth canal, along with the head being cone-shaped. C-sections babies will have a nicer shaped head because of this. The baby's arms and legs are bent or frog-like, and the hands will be closed fists. The skin will be a bit blue, and the breathing could be rapid or a little irregular. Don't worry, moms and dads. This is short-lived, and the baby will gradually come to the perfect little dream baby in form. Now, there are many factors that will help with the ease of the birth process. The physical and emotional condition of the mother plays a big role. Also, having good prenatal care, following a nutritious diet, and having a good rapport with the doctor and nurses will help out the situation. Taking childbirth education classes beforehand can help prepare the mother mentally for the birthing process. The size of the fetus will influence the birthing process as well. It is really the size of the fetal head in relation to the size and structure of the mother's pelvis. There are two different types of delivery. The vaginal, in which the 3 stages of labor I just previously described are according to, and the cesarean section, or also called a C-section. Most deliveries are spontaneous vaginal deliveries. However, there has been an increase of cesarean sections. The reason for this is because if there is severe fetal distress, malpresentation, dysfunctional labor, or multiple births, this may require a cesarean section. This is when the delivery of the fetus is through an incision in the abdominal wall and the uterus. This process will allow the baby to be delivered quickly. Newborns are referred to neonates for the first 28 days of their life. These 28 days are the most dynamic and challenging for both babies and parents. Within minutes of the newborn, it will be assessed using the APGAR. This is a simple scale that will look at the heart rate, respiratory effort, muscle tone, reflex, irritability, and color. The test will be done at 1 and 5 minutes after birth. The baby will then be wiped down, dried, and wrapped in a blanket, outfitted with a hat, and will be placed with the mother once again. This will be the first time that the mother and child will begin interaction, and their new relationship will begin. It is an awesome experience with love at first sight. The experience is unique and intense. Infants are usually put to the mother's breasts soon after birth. Hours after birth, the newborns will experience their first medical procedures. Blood and urine samples are taken for screening. Different states have different requirements, so make sure to check with your doctor as to what tests will be done to your child. Newborns are also screened for a possible hearing loss. Birthing patterns are continuing to change. Before a non-complicated delivery, the mother and the baby would go home within 48 hours of birth. Some hospitals, birthing is considered an outpatient process, and the mom and the baby will leave within 24 hours. However, nowadays a typical stay is 2 to 3 days. The 3rd and 4th day is important because a common condition called jaundice can occur. This is when the excess of bilirubin will cause a yellow coloration of the skin and whites of the eyes of newborns. Most new mothers cannot accurately judge the level of the bilirubin. If the level of bilirubin is very high, it moves out of the blood and is deposited in the brain tissue. This can cause many different types of neural problems. Don't worry, moms. If treated, it is entirely preventable. Just make sure that when you are discharged from the hospital, you have a follow-up medical care. Your doctor will give you instructions and help you with lowering the bilirubin levels in the baby. The baby's weight and age of birth does play a role. The first question by everyone is always, how much did the baby weigh? Birth weight and gestational age are significant because it is most widely used in determining neonatal risk. That means if the baby is at risk. This can determine the expectations for developmental patterns. The typical birth weight is 6.5 to 8.5 pounds. If a baby weighs less than that, it is considered low birth weight. If the baby weighs over 9 pounds, the baby is considered large for gestational age. When the mom has a baby also can be a factor in regard to developmental patterns. Infants born before 37 weeks are considered preterm. Being a preterm infant, the baby comes into the world at a disadvantage. Being born too soon means the baby has to make more of an adjustment from the inside of the mother's body to being in the outside world with less developed body systems. Immature organs may not be ready to perform the necessary tasks of everyday life. Infants born after 42 weeks are considered post-term. Doctors will look at the gestational age and the weight to determine if the baby will need any additional assistance until the baby is ready to enter the world and become an active member of the new family. 13% of infants are born before 37 weeks. 8% are born weighing less than 5.5 pounds. 11% of all pregnancies are preterm births. Preterm births account for the majority of neonatal deaths. Preterm births account for half of all neurodevelopmental disabilities that are present at birth. Preterm births are rising, and the common causes are maternal infections in adolescents or both. Preterm babies could have respiratory, cardiovascular, neurological, gastrointestinal, or other physiological problems. Respiratory problems happen because the lungs may not be fully developed. In mild cases, infants will be given supplemental oxygen to help them until their systems can produce enough. Some premature infants have circulatory system problems. One of the most important problems is that there's a hole that allows the fetal blood to bypass the lungs. This hole needs to be closed. However, about 30% of premature infants do not have a closed hole. Medication can be used to help this duct close. A preemie can also have an immature central nervous system. This controls respiration and circulation. Two common problems are apnea and bradycardia. Apnea is respiratory pause of 15 to 20 seconds. Bradycardia is a drop in the heart rate to below 80 to 100 beats per minute. The smaller the infant, the more likely the problem. Premature infants are twice as likely to die of sudden infant death syndrome, or SIDS. Monitors can be sent home with an alarm for parents and may also provide some reassurance. Premature babies will most likely need an intensive care nursery. The neonatal units are designed for high-volume, short-term care. They will focus on the medical concerns of the baby. They will be staffed with a pediatrician who specializes for ill and premature newborns. This can be a very threatening place for most parents. The equipment can be scary, as with the noise level of monitors beeping and personnel moving around quickly. Overall, the end of pregnancy is marked by the birth and delivery of the newborn. Traditionally, babies have been delivered vaginally, but increasing numbers are being born through a cesarean section or a C-section. Most deliveries do go smoothly. However, there can be complications, particularly with preterm infants and multiple births. The transition from fetus to infant is a dramatic one, but is something that is worth the wait. Newborns are far more capable at birth than we once thought. Technology and medical advances have dramatically increased over the years, helping to put parents' mind at ease. Remember that every mom and every baby is unique. That's why the hospital and staff will be dedicated to providing you with the personalized care in order to achieve the birthing experience you desire. This is an amazing time for the mother and the child. There will be bonding and a form of intense attachment like you've never experienced before. Parents will automatically want to shower their new baby with love and affection and protect and nourish their little one. Enjoy this special time together.